Hi, my name is Jenna, and my project is on the opioid epidemic in the United States. Some goals that I had for this project was to observe the causes, trends, common themes, available treatment, and barriers to care on the opioid epidemic in the United States, as well as to study the effects of the COVID-19 pandemic on the opioid epidemic. Some quick definitions is an opioid is a broad class of pain-relieving drugs that act on opioid receptors in cells. These can be either illegal or street drugs or medically prescribed, and some examples include Oxycontin, fentanyl, and morphine. Addiction is a chronic medical disease that involves complex brain circuit interactions and also involves genetics, the environment in which a person lives, or the life experiences that they have. An epidemic is a sudden increase in the number of cases of a disease above what is normally expected in the population that is being studied or looked at. Some quick facts about the opioid epidemic today is that in 2020, approximately 75% of drug overdoses were due to opioids. And a lot of this might have to do with pain management and overprescribing drugs and people getting addicted and overusing the opioid drugs. But a high level of overdoses comes from non-prescribed or street drugs, and this includes drugs that may have been laced with something like fentanyl, which makes the potency a lot higher and the chances of overdosing a lot more likely. Harm reduction is often criticized, and in some places it's even protested against, banned, or illegal because societies compares opioid addiction with bad character, and there is a very strong stigma against addiction in our society. Some health disparities that go along with opioid addiction could be if somebody has access to healthcare or have a community support system that supports prevention strategies or properly taking drugs in the way that they were prescribed or disposing of them properly when they were done with them, or if they have the support in the community as well as familial and societal support, education awareness about opioids and how to prevent or treat addiction, whether or not they have health insurance, or race and ethnicity. And we'll see later on that race and ethnicity does not necessarily correlate with opioid addiction in the ways that we think that it does. Um, but overall, opioid addiction does not really, it can affect everybody essentially. It does not really specify towards a specific race, gender, ethnicity, anything like that. The methodology for this project, I searched databases and journal articles, and this included the American Journal of Public Health, Population Health Management, and the Journal of Urban Health. And some of the study designs that go along or went along with these journal articles was observational studies and surveys were used, randomized experiments were used. I believe 4 or 5 analysis were used. A lot of interventions and interrupted time series analysis. Some additional methodology is I studied reports from the United States Department of Health and Human Services and also from the American Society of Addiction Medicine. I also looked at some newspaper articles from CNN, the New York Times, and The Guardian. Some significant findings from this project is that in one of the journal articles reported that in a 10-year study, 49% of media outlets use one or more stigmatized term when addressing the opioid crisis, and this just further stigmatizes the drug and opioids in general and further stigmatizes people who may be addicted to them and struggling with addiction. As I just said, there is a harsh stigma towards opioid users in general, but there is a more harsh stigma towards lower class opioid users versus middle and upper class opioid users or addicts. About 79% of opioid overdoses are non-Hispanic white individuals, and this kind of goes back to what I said about how opioid addiction doesn't necessarily um, gear towards a certain race or ethnicity in the way that we think it is. It is mostly non-Hispanic white individuals. And community health centers and harm reduction organizations are usually left to fend for themselves. When it comes to finances and staffing, they're usually left alone to fight the battle. The COVID-19 pandemic really increased overdoses and deaths, which we could talk about more later. It reduced access to interventions, it reduced cross collaboration between systems. There was a big loss of mental health support and just overall everything during the COVID-19 pandemic that affected everybody really dug in its heels, I guess, for lack of better words, to the opioid epidemic and overdoses and mortality due to opioids. Some correlations is that in 1990 between 1997 and 2017, overdoses more than tripled between the ages 55 and 64, which was the largest percentage increase over the study. And in 2010 to 2014, there was a 100% increase in hepatitis C and a 500% increase in opioid usage. And there was just some correlations between those and some other aspects of public health, like greater population size, lower education levels, how many opioids were actually prescribed before there was really restrictions put in place, engaging in harmful behaviors, or or in the increase in addiction and overdoses. The cost burden on the United States is that fatal overdoses and opioid use disorder cost the United States $1.5 trillion in 2020, which was a 17% increase from 2017. There's also a burden on individuals, caregivers, and their families. It is a reduced quality of life, mental health disorder, stress, isolation, suffering, and children who have opioid addiction in their family or their parents are struggling. It could have really detrimental effects to them and their mental health. Some public health implications is that there are increasing trends in overdose mortality. In the past 2 decades, there was a 2 times mortality increase in men, but there's a more rapid mortality increase in women. Opioid overdoses increased significantly post-COVID. The effects from the pandemic, as I stated earlier, cross demographic, socioeconomic, and neighborhood boundaries, and factors like race, ethnicity, age, etc., all remain the same. So there wasn't necessarily specific race, gender, or ethnicity that was burdened more than the other, more than the normal trends or the already increasing trends, but overdoses and mortality definitely increased. Some further implications was that policies that reduce prescription opioids may cause both good and harm. There is a big, I guess, push towards slowing down on prescribing opioids because of the fact that a lot of people do get addicted and go to seek more. So when there is a decrease in prescription for opioids or for pain or for chronic pain or for surgeries and stuff like that, there may be a reduced quality of life for the general public who needs those pain relievers. However, there could be an increased heroin usage or increased fentanyl usage for those who overuse the system and get overprescribed purposely to get because they're addicted to the drugs. A population health approach may be most affected in combating the epidemic, really targeting a more upstream approach and looking more at prevention could help to prevent and educate more people about opioids and addiction, while the downstream approach could target access to treatment and improving health outcomes rather than just stigmatizing or leaving people in the dust, essentially, and whether it be imprisonment time or simply excluding them for society, really focusing on treatment and access to care. Some practical recommendations include making Narcan accessible, which I believe it was recently passed that Narcan was available over the counter. And on a lot of college campuses, there is trainings and access, which is a great way to really make it more accessible and teach more people how to use it and what it really is. Some other recommendations would be to improve, increase, and decriminalize harm reduction safe spaces, as these could be essential for people to get the treatment they need and be essentially um, watched over as they are participating in their in taking drugs so that a certain amount is taken and they are watched and they are cared for. Supporting underfunded and understaffed community health centers and financing upstream preventative programs can be especially important as well. There should be an increased collaboration and communication between healthcare centers, the criminal justice system, social services, etc. There never really was a great collaboration to begin with, but because of the COVID-19 pandemic, the gaps were just widened between these systems. So it could be essential to really bridge the gaps back together and so people don't fall through. And it's especially important to reduce access or barriers to care and increase support for opiate addiction rather than just stigmatizing against it and being so against these people who deserve treatment and deserve care and deserve help. And that pretty much concludes my presentation on the opioid epidemic. Thank you so much for listening, and I hope you learned as much as I did.